Hi, everybody. Thank you all for coming. My name is Chelsea, and I am VP of Operations for Healthcare Networks of America. H&A exists to connect private practice physicians to the best resources to help you run an impactful and profitable practice. So while we get started, let's go over a few housekeeping items. If you look to the upper right-hand corner, you can see chat. So if you go into chat, we're going to have a poll in there, and I'd like everybody to open up that poll and answer it just to make sure everything's working. See, there we go. The poll is up. So if you could just answer that really quickly. And then we will also be just doing polls and handouts throughout the entire presentation. And any questions that you have throughout the, e-course, I want you to drop it into that chat button there. So right now, after you finish the poll, go to the chat and let us know where you're watching from. Give us city and state, just so we can see that everything is working properly. And then we can just kind of get a better idea of where everybody is watching from. So go ahead and do that in the chat. Perfect. Thank you, guys. Okay, so we have 20 minutes of great content on the future of medicine, data collection, how to choose the right remote patient monitoring service for your practice. And towards the end, again, we'll have a Q&A. So as you have questions, drop them in the chat. We have a moderator watching, and they will shoot those questions over to me throughout. I now want to introduce Fred Rowe, CEO of Healthcare Networks of America, a national physician network of over 10,000 doctors whose mission is the preservation of private practice medicine. Take it away, Fred.
Thanks, Chelsea. As Chelsea said, I'm CEO of Healthcare Networks of America. We've been around and were founded in 1993, and our sole purpose is to be able to help doctors prosper in private practice medicine. It's very well known that 2020 was a really hard year for doctors. It's no secret that it's getting harder and harder to stay alive in private practice, and COVID sure didn't help things. But there also has been an opportunity that has emerged out of COVID, and that is virtual care. Acceptance of virtual care by doctors and patients has skyrocketed as a result of COVID. 77% of patients are now seeking doctors who offer various forms of virtual care. Less than a year ago, that number was under 20%. So as you can see, it's almost multiple of 4 of the patient's interest and receptivity to that. Patients also report higher levels of satisfaction when the doctor offers both in-person and virtual care. That's really the ideal that a patient wants, is both the in-person option and the virtual care option. And 90% of patients said quality of care was good or better with virtual care. So today we're here to talk about one component of virtual care, which is called remote patient monitoring, which in my opinion is one of the best financial opportunities for physicians that has come along in decades. It's very well known, all the problems in the healthcare system. This is no secret also. Exploding healthcare costs. Medicare is bankrupt. There's a healthcare labor shortage, particularly in rural areas. That's why we're seeing the advent and the encouragement of virtual care and physician extenders. Chronic diseases are actually increasing. Aging baby boomers. I saw a statistic the other day that said 10,000 people are turning 65 every day. And then the last item here, still the statistics show about 25% of patients are still uncomfortable going out to travel to a medical clinic because of the pandemic. Every doctor, in my opinion, needs to be thinking now, how do they position themselves for the future? Change is happening at a rapid escalating rate. And it's very important for doctors to be able to say, how am I going to adapt to that change? And how do I become the doctor for the future? And the major changes that need to be focused on have to do with the ability to manage the cost and quality of care of a population. Think of this in terms of every doctor is going to be given a population to care for. The way that you make yourself profitable to a payer who are the people who pay your bills, the insurance companies, Medicare, self-funded employers, those kind of people, is that you can demonstrate improved quality of care at a reduced cost. And you're going to be able to see as we go through this, a lot of the information tools and data collection tools that you're going to have in the future are going to help you do that. And this is really all about reducing hospital admissions and readmissions. Those are the high ticket items, and that's what has to come down. The components that are going to be driving the new system have to do with chronic disease management. So it's not just that you do one specific piece of chronic disease management. You are going to be more valuable as a doctor if you can say to yourself, I can show the impact that I have on the improvement and management of this disease as well as the cost. That's where we're going to be moving more into what is called personalized care and precision medicine. This has to do with using data, artificial intelligence, data analytics, machine learning, and all these kinds of things to more appropriately personalize care to the people. That in terms of what you prescribe in your treatment plans. What makes a good doctor? It's always been kind of the debate, is medicine more science or more art? I'm going to suggest it's both, and I'm going to add a third. It's going to be data analytics. The sophistication of data that a doctor is going to get in the future and is going to be available to them is going to be dramatically enhance their ability to design personalized care and treatment plans that meet those goals of reducing hospital admissions, preventing the incidence of disease, and being able to manage disease more cost effectively. Just a little bit more on our organization. We are not the remote patient monitoring company. We are a national network of providers, and what we do is we go out and do due diligence on companies and on services that we think private practice doctors should incorporate into their practice. And so our whole focus is to be as objective as possible, to just try to see what works and what is beneficial to the private practice physician. So many programs and so many services that get offered to doctors are beneficial to somebody else, not to the doctor. The doctor might get a small office visit fee, but the vendor's the one who makes all the money. This is not what we like to see. We like to see programs where the doctor is the one that benefits most from bringing in the service and innovation to their practice. So again, we've kind of scoured the countryside for all kinds of vendors in the RPM category in this virtual care area. And that's what we're going to be presenting you today, is about our findings. After this e-course, we hope you can do this. First of all, select the right vendor. We're going to try to help guide you on what to look for. Second of all, to understand technology, to get some understanding of what technological advancements are going to be coming at you, and to be able to distinguish between those that are going to be most helpful. Most importantly, it has to do with billing. And we want to talk about billing specifically as it relates to remote patient monitoring, because if you don't bill right, you're not going to get paid. So that's a crucial element to this whole program and anything that you do. There's really three major kinds of remote patient monitoring, and I'm going to refer to this as RPM by the acronym. There's the chronic care side, there's transitional care, and there's enhanced annual wellness visits. The third one, which is in purple, is the easiest one to comply for and to get reimbursed for. The other two are either short-term or more complicated to be do it. So our focus is going to be on the enhanced wellness visit. Okay, we're going to do a poll question right now just to get you guys a little bit involved. Do you currently have patients collecting any physiological data from home? Please answer that question in the poll. Okay, as typical, we're seeing a mixture of people, some who are, some who aren't. So let's move on to the next slide. Again, I talked about the doctor of the future and the future of medicine. And this is just going to be talking about where I've been stressing that data science, how that data is interpreted, how that data is translated into diagnosis and a treatment plan. What you see here are the different components of how data is going to be aggregated and analyzed. You know, in the middle here, we see EMR integration. Very important that everything feeds into one software. I've already talked to some doctors who may have 4 or 5 different software systems working because they're using different RPM devices. That is not recommended. You want to be able to see something that is simple to read and have something that all integrates into one system. You want to have a system that's device agnostic, you know, that can really adapt to whatever device you're sending out to be monitored in the home. Also included in that data in the future is going to be genetic data and how that is captured and where you get it from. The cost of gathering genetic data is declining massively, and this information is very valuable to have in terms of any diagnosis and treatment. Information about real-time vitals and visits and what happens on an ongoing real-time basis. How the data is presented is going to be very important. Another component is artificial intelligence. Artificial AI is going to be incorporated into all the top-level systems to be able to analyze and synthesize the massive amounts of data coming in so that it's made simple for the doctor. That's really the goal in any of these, that it's made simple for the doctor. All of these changes have to do with advancements that are happening in the world of technology. And I keep up on technological advancements in the medical field, and it is staggering the rate of change. And it's just going to escalate more and more, and it's going to be difficult for doctors to keep up. So smart doctors are enhancing their capabilities to be able to incorporate the technology and being able to identify what to look for. And remember, all these advancements are facilitating a shift out of the hospital into the doctor's office. So as we all know, many doctors have made a lot of money for a lot of hospitals. Now, because of technology advancements and because of the cheaper cost, payers are preferring to see those procedures done in a doctor's office and within the control of the doctor. This is a major shift that's going on and a major opportunity for doctors, because basically a lot of that hospital revenue can transfer back into the doctor's office. And the components of these technological advancements primarily have to do with wearable devices for remote monitoring. You know, I'm sure you're all familiar with Apple Watch and how this started. And, you know, there's 1,000 devices out there now and going to be 10,000 devices in another 2 years. And they're just getting more and more sophisticated. It's all about prevention and early detection. Remember, keeping people out of the hospital, reducing readmissions, and also having to do with being able to do genetic testing and the technology that's available for that. Company that we're going to talk with specifically about RPM is GatherMed. This is a vendor that we have selected to get behind because we think it meets all the criteria that we look for in a vendor in terms of being able to put quality of care at the top and money in the doctor's pocket. Kind of the features that we're looking at here and what makes it easy for doctors and patients. Remember, the key to remote patient monitoring is to make it simple. Will the patient use it? Will they comply? You all know the issues of patient compliance. It happens to remote patient monitoring as well. And to be able to have the data to be easy and quick to read on behalf of the doctor. So as you see here, some of the issues: no app to download required, no complicated login, Bluetooth pairing, Wi-Fi is not an issue because they can use cellular, EHR-ready, and customizable report. You can imagine if you have an 85-year-old person and their Wi-Fi goes down, you may be without data for 2 weeks. And if you're involved in remote patient monitoring, you can't afford that because that's going to interrupt the requirements that you need to have to be able to do your billing. This just gives you an example of what some of the information is that you'll see on a screen. And, it has to be able to visualize real-time data. As measurements get taken at the patient's home, you can see this on your screen in the office. And then number 3 here, which is most important, well, equally important, is that you have billing ready reports. You want to be able to bill, you want to be able to bill accurately, and you want to have the supporting documentation to go along with it. This particular company, what we like about them is they're working with some of the big players right now. Most notably is Skylight here, which is a national chain of primary care practices. They're going to have 500,000 patients in their system by the end of 2021. Their goal is to have 150,000 patients doing remote patient monitoring, by the end of the year. The services that are included in GatherMed's program is obviously to digitally gather the physiologic data and deliver it to physicians to interpret. So how you're able to see that on the screen is very important. Patient adherence is a huge deal so that they can train and continue to monitor the patients for their adherence to taking the particular measurements on the device that they have, which is very important to do. They notify them, they can see if they're missing certain measurements. And also, like I've said before, to be able to produce billing reports that you can get reimbursed on. Features that we're always looking for. Number 1, going left to right, connecting patients' data to their doctor's EHR. It's a big deal. I've said it 3 times now. I'm going to keep saying it. Always connected and easy to use for the patient. This particular company uses cellular. They can go Bluetooth and Wi-Fi if the patient wants to, but the devices are hooked up for cellular, which is considered to be much more reliable. Device pre-configured. The patients get devices that are simple and easy to use. Easy access for the physician in the portal being configured, and this can be customized for you, kind of depending on the program that you acquire. But you're going to find over time, after you start using it, that you may want the information to be tailored in a certain way. Also, just to make collaboration simple between the patient and the doctor, the communication is very vital here. And just to make it very seamless for the patient. I just kind of the overriding principle, make it simple, make it easy, or it's not going to work. And that's where, you got to be looking at vendors, you got to be looking at programs that, get rid of all the obstacles that can interfere with the process. Some of the devices we recommend, it's obviously got to be in your scope of practice, but blood pressure is a great way to start. We recommend that people start slow, do a little pilot. Blood pressure is something that people are accustomed to doing at home. This is a particular device connected by cellular that they will need to be given by the doctor, and then to be able to get the measurements being taken on an ongoing basis so you can see how the program works. There's also blood glucose monitors, scales. There's a sleep study and sleep apnea devices, pulse oximeter. And just so you know, there's going to be an endless list of devices that are going to be coming down the pipeline to monitor that are reimbursable. And what's going to be important is that you have an agnostic system that it can incorporate whatever device into it. You don't want to be running individual portals for individual devices. This just shows GatherMed's program. is adaptable to every EHR system. Again, very important. You don't want to be running separate portals, separate systems. Let's get into the billing. If you can go to the open chat, you can download this form, and this is going to be for you to have. This shows how the coding goes and the reimbursement is. So to do this, download open chat, select handout, and click download. Go ahead and do that, and I will go over that. Okay, just to go over this, this graphic shows 3 different components: transitional care and the codes that apply to that, chronic care and the codes that apply to that, and in purple, what it is are the ones that apply to the annual wellness visit codes. That's what we believe is the one that we should be using for RPM. It's the easiest to get reimbursed for, easiest for the patient to qualify. And just to go over the codes and the reimbursement. Setup is 99453. That's a one-time fee you get of $19. Device fee is 99454. By providing a device, you are able to get paid $62 a month for providing that device. So for example, for providing this blood pressure cuff, let's say for example, that costs you $95. The doctor pays that $95, gives it to the patient, patient gets set up by GatherMed, and then you bill $62 a month for that. So you make your money back in month number 2. Now into the clinical monitoring codes. 99457 for the first 20 minutes is $52 per month, and every additional 20 minutes is another $42. Very important to know that the monitoring does not have to be done by a licensed medical professionals. It can be done by your administrative staff. Treatment plans, changes in treatment plans, diagnoses, those kinds of things have to be done by licensed providers. But in terms of the monitoring, this can be done by a lower level person in your office. So if you add all these up, you could be getting on a gross basis about $198 per patient per month. Now, you've probably all seen some grandiose numbers thrown around. This is based on 4 of the CPT codes that I talked about earlier without taking any expense out. This is gross revenue. But as you can see, with 100 patients, you add $237,000 per year of gross revenue on up to 1,500 patients, $3.56 million. Looking at it for some of you smaller practices, just to kind of start and be more conservative and realistic, this is like net numbers, because I'm using, you probably when all is said and done is net, about $100 per patient per month. So again, if you were doing 50 patients per month, that would be about $60,000 net per year. On up to 100, get you 120,000, 150, get you $180,000 per year net using those 4 CPT codes. And that's at 150 patients. I mean, like I said, we're working with, GatherMed is working with Skylight right now. We were able to bring them that client, and they're intending to do 150,000 patients over the next year. And remember too, what's very important to consider here is Medicare is promoting this. They have been defining the criteria. They've been increasing the rates. One of the few things they've done this on, because they believe overall this will save money to the system, because it's going to prevent illness and disease and early detection and keep people out of the hospital, which are the big key to the future healthcare system. Implementation for this starts out with contracting. There's a subscription agreement to sign. Implementation specialist meets with you to be able to specifically design this for you, see if there's any customization. The launch has to do with, we recommend you maybe start with 20 or 50 patients, go through the process, see how it is, use a simple device like blood pressure, get your reimbursement, and you're able to see before you really do it on a mass scale, and then implement the monitoring that's involved in it as well. Well, that's the end of the presentation. We're going to go to questions, and then what we'd like to be able to do after questions is to be able to give you an opportunity to set up a time to talk to Chelsea to try to be able to see what your specific situation is, because every situation is different, every practice is different. It's very important to be able to tailor this to what you need. So Chelsea,
Okay,
let's
so we
go
have a few
into the
questions.
Q&A.
If you guys have any more questions, drop them in the chat and we will try to get to them. I know we're running a little bit over, but the first question, you talked a little bit about the cost of the device, like $95, but what are the other costs to GatherMed?
There's a couple different ways to do the program. If let's say you're a smaller size practice and you want GatherMed to do the patient compliance and the system as it is, their cost is $60 per member per month, per patient per month. So going back to the original slide we did, about $198 minus 60, you would average about $120, $130 net. We tell people when all is said and done, they average about $100 per patient per month net. There's also a way that you can white label their software and you kind of do the system for yourself. And that can be explained to you through a consultation with Chelsea and with GatherMed to the details of that. But that is a cheaper option to go, but more of the work is put on you.
So another question is, you have to monitor their data for 20 minutes to get reimbursed by Medicare. How does that 20 minutes get recorded in the GatherMed system?
There's timers in the system that it includes all the way from somebody sitting at the desk looking at it, to writing an email, to making a phone call, to doing the actual measurement on the device, to designing a treatment plan, and that all gets documented on the system. Again, this is crucial because you have to have that documentation in case you were to get any kind of Medicare
Well, and
audit.
those, I'm guessing all of those
right.
numbers come then at the end of the month report that is sent to the doctor, right? Okay, awesome. And then it doesn't look like we have any more questions now that we're running over. So the last one was, how do I get started? So I'll just answer that. If you see that pop up, again, like Fred mentioned, we're offering a free 15-minute consultation, based off of what specialty you're in. We'll kind of talk about, the size of your practice, how many we could probably get started fairly quickly. And then, we'll kind of move towards getting a different consultation with GatherMed. So if you want to click that Get Access button, you can schedule with me. I'm fairly open. I'd love to talk to you guys, but we just want to thank you guys for coming to our e-course on remote patient monitoring. I hope you got a lot of information. If you have any questions, please just book a time with me, or you have my email, just shoot me over an email and I'll be happy to answer any question you have. All right. Thank you guys.
Thank you.